AM and 107.3 FM.
Back to open phones to wrap things up later on. Back to that toward the top of the hour. When we get there, we'll be at 203-333-9422, 333-WICC. To the subject of COVID-19, the latest subvariant and how we are doing there and what could be coming now. Hopefully better news if the warmer weather is coming up. One of our go-to folks since this thing all started 2+ years ago, and we have these people on a regular basis. Dr. Sarah Crawford, professor of biology at Southern Connecticut State University, joins us. Dr. Crawford, Paul here again. Good afternoon. How are you?
I'm fine. It's a pleasure to talk to you again.
Well, thanks, Dr. Crawford. We appreciate it. Well, I'm looking at the daily numbers here for Connecticut that come over about 3 o'clock every day, as you know. Positivity test for the rolling past 7 days, just a hair under 9%, 8.85%. About 230 people currently hospitalized around the state, doctor, with some manner of COVID-19. We don't know the severity. Those numbers tell you anything? How should we interpret the numbers we're hearing now on a daily basis?
Well, I think the numbers in Connecticut are reflective of what's going on in the Northeast. New York City today went up to medium alert. Clearly, the Omicron 2 is in full swing here, and it's causing an uptick, considerable change in the incidence of infection. Fortunately, the state of illness in terms of severity is not too bad for most people, but I think it is something to be watching out for, especially since a lot of the mask mandates and other precautionary measures are being put aside based on our hopeful feeling that this is all over. We're not quite there yet.
I did read a couple of experts, doctor, over the weekend, pretty much echo what you said, but they also said, both of them, hey, there's still about a 5 to 10% chance here of a major rebound that could send us back to wide mandates, could send us into even more inoculations. What are your thoughts on that?
Well, I agree. I think we're not in a stable situation. As long as we have the continuing emergence of variants, and now we see in South Africa there's a BA4 and a BA5 in the pipeline coming up, which that's where Omicron started. So that's something to be concerned about. We have China, which is in a very serious predicament right now, thousands and millions of people on lockdown because there's a zero tolerance policy. And if were to COVID to break loose there, all bets are off in terms of what types of mutants might emerge. So I think we're at a time where we're sort of doing watchful waiting. We're going to be seeing what's going to happen, but we can't predict with any certainty. But clearly, this is not over yet, and there is still a risk that very serious variants could emerge.
You mentioned, Dr. Crawford, China, and I've been following this closely. Yeah, it's a zero-tolerance policy. We can really see that where people are basically kept prisoner in their homes or apartments, or if they're not sick, there's been, there's been, a forced takeover of some of the places they're living for people who are sick. Would the Chinese, you think, be doing this if it was one of the previous variants or something we know how to deal with, or do you think there might be more going on here or not?
Well, I think it's hard to say with certainty since they're not very revealing in terms of what's going on. But I think we have several factors. We're not sure how well vaccinated the population is. We're not sure how well the vaccine that they're using works. And we're not sure what the variant status is over there. They're doing a lot of testing. I'm not sure exactly what data they are releasing. So there's always the possibility, if you're dealing with a poorly vaccinated community, that you're going to have higher incidence of new variants emerging. And it really is a black box, and it is something that the unknowns are cautionary in terms of this is where it all started. And we cannot, at our own risk, we ignore this.
Dr. Sarah Crawford's the guest. Dr. Hang-On will be right back with you, and when we come back, we'll get her opinion on the second booster that, from what I read, not a lot of people are taking, but we'll ask her about that. And some news that has come out about this pill form of therapy, this Paxlovid, over the weekend. We'll get her opinion on that and more. First, traffic and weather together right here, WICC.
WICC Right Now Traffic.
Still heavy traffic out here. 95 northbound Greenwich running out to Bridgeport. The worst spot moving into Stamford, and then again from Westport out to about Fairfield as you're getting around that Southport corner. Over on the Parkway, pockets now are coming in. Exit 31 all the way up through exit 52. And Route 8 you're taking in also exit 11 and 12. So we're busy. It's wet out here. Careful travel. Now, which family-owned company has been supporting the construction industry for over 95 years? It's W.I. Clark, of course, providing you with John Deere, Workman, Levoy, and Indigo equipment. Their equipment is so productive, it can't help but improve your bottom line. WIClark.com. Kelly Quinn, that's your Right Now traffic update.
Showers ending tonight near 45, then considerable cloudiness for tomorrow in the low 60s. Showers developing tomorrow night, 45 to 50, then scattered showers continue for Wednesday near 60. Thursday will be mostly sunny near 70, then rain showers return for Friday in the low 60s. And finally, Saturday will be partly sunny with afternoon showers near 70. Weather every 10 minutes on Connecticut Today.
It's Howie and Ken from Spectre Furniture and Mattress Gallery, Main Street, Ansonia, celebrating over 132 years in business.
Spectre's recliner trade-in sale is finally here. Can't trade in your in-laws.
So you can trade in your old recliner to get free removal. That's right, free removal when you buy new. Only at Spectre Furniture.
Lazy Boy recliners, all on sale.
Trusted for over 132 years.
Spectre Furniture and Mattress Gallery, Main Street, Ansonia, SpectreFurniture.com.
And thank you for shopping local.
Bad decisions limit future options. Make enough bad decisions and you will destroy your life. Listen to The Flatline with your host, Rick Hughes, every Sunday morning at 5:30 a.m. here on WICC 600. The Flatline describes a main line of resistance in your soul built in God's Word. Join us every Sunday for 30 minutes of inspiration, motivation, education, all without manipulation. That's The Flatline with Rick Hughes, heard here on WICC 600 every Sunday at 5:30 a.m.
If Terry Ann's talking about it, so is Paul. Connecticut Today with Paul Pacelli on WICC 600.
Dr. Sarah Crawford's been with us several times in the past 2+ years to talk about what is going on with COVID-19. She teaches at SCSU, Southern Connecticut State University, professor of biology there. Dr. Crawford, on the second booster, I got mine. I'm well over 50, but I got it, and no real big side effects here. But from what I understand, the uptake on the second booster is not where experts thought it would be or where they would like. What are your thoughts on the second booster? And we're going to see more of this down the road.
Well, yes, it's a complicated question. In late March, the second booster was approved for those over 50 and individuals who are immunocompromised. So that certainly is advisable. However, data from Israel suggests that the immunity wanes very quickly after the fourth booster, that within 4 to 6 weeks, your levels of antibodies are back down to where they were pre-booster. So that it's of questionable significance in terms of protection. Certainly short term, yes, but we're dealing with a protracted pandemic here. So I'm not sure exactly how beneficial it is. I think one of the issues here that complicates the situation is the Omicron and the fact that its spike is so different. The BA2 is so different from where we were earlier in the pandemic with the variants around then, that the antibody response is not good and not lasting for that particular variant. So there are some issues with the vaccine. It's not an insurance card. It's a preventative tool, but it's certainly not a guarantee that you won't get sick.
So it sounds like, doctor, in layman's terms here, the body is always playing catch-up here trying to say, oh, here's another new one now. I've got to put this in the circular file, right?
Yes, there's a lot of research going on now to see where immunity stands with the vaccines, without vaccines. And it's clear that there is a good sustained T-cell response, which is the long-term immunity to the virus, to the Omicron, which is very exciting because there was concern that this might be an issue. Antibodies don't respond well, but it seems like the T cells do, which may be why the infection is not so severe as it might be. So I think that that is good, but there's a lot more research that needs to be done to see where we are in terms of these vaccines, because at this point, we're not getting a durable response, and that is very concerning.
To Paxlovid, doctor, which, as you well know and people may know, is the Pfizer pill form here of the therapy for COVID-19. Kind of some mixed news I read over the weekend. I guess prophylactically, or as a preventative measure, it didn't quite cut the mustard, did it?
No, well, it's really not designed to. It is a treatment. It's not a vaccine. So the idea is that if you've been exposed to COVID, if you have the infection and you take the Paxlovid early on, it weakens the ability of the virus to spread in the body. However, that being said, there are some cases of breakthrough that the drug brings down the virus for a certain period of time, but then there's a rebound effect in certain individuals where they get a second round of illness. So even the treatment is not 100% necessarily. And the idea is not that you're going to prevent infection. The idea is to mitigate, to make it less, to make the side effects less serious in terms of immune system consequences. But again, as encouraging as it is to have a therapeutic, it's certainly not a magic pill.
Are we getting, Dr. Crawford, any better grip here? And maybe this was illustrated more in the early parts of this, as to why some seemingly healthy, virile young people or younger people get hit hard, and yet you see these stories of people in their 70s and 80s, and early on there were some people in their 90s who had it rough, but were able to get through this, and why some people end up in the hospital and some don't. You know, if you strain out all the mitigating factors of obesity and other sublying conditions, do we have any better grip as to why there's such a wide variety and who gets this thing bad and who doesn't?
Well, I think we have some pretty good demographics. We know who the vulnerable populations are, certainly older individuals, immunocompromised individuals. I think the problem is that you're always going to have outliers. Each human being is unique, and we don't really know very often what the underlying factors might be. There may be issues with the immune system that are not transparent and don't show up in regular testing. And the system is put to the test, in effect, when you get a disease like COVID. And this is where you're going to see individuals who have compromised immune systems and other types of complicating metabolic issues that may not be obvious, where that effect could be very serious. And thank goodness it is rare, but it does happen. And I think, again, there's no reason why we should be complacent about this, regardless of our age or our status of health currently.
Dr. Sarah Crawford, thank you. Professor of Biology, Southern Connecticut State University. Have a wonderful day. Rest of the month, and we'll check with you down the road as the weather warms. Thank you.
Thank you so much, Paul. Take care now.
Appreciate it.